work for me. So as I said a few minutes ago, this is the 2023 Medicare changes, and we're going to be looking at premiums, deductibles, copays, and benefits. I'm sure many of you feel like this gentleman. If I make a mistake, if I miss a deadline, what is all this stuff about parts A, B, C, and D? Why do I care about all of that? So the good news this year is that probably most of you have heard that Social Security is going to do an 8.7% increase in Social Security starting January 1. Now, what that means for you as an individual is that if you are making $1,000 a month in Social Security, you will get $87 more. Now, what routinely happens is that when you get an increase, then Medicare increases their premiums, their deductibles, and then you really usually oftentimes don't see very much in an increase. Although it's not very much, and we'll look at it in a little bit, several of the charges that you will be facing in Medicare did actually decrease for 2023. The most important thing to know in terms of Medicare is that we have Medicare parts and we have Medicare plans. And the plans are sold by insurance companies. So we have Medicare Advantage plans, we have prescription drug plans, and we have Medicare supplement plans. Medicare, on the other hand, has parts, which are A, B, C, and D. And the thing to remember is that although we use the words parts and plans sometimes interchangeably in the English language, when you're talking about Medicare, you need to separate those out so that I or whomever you're visiting with knows the difference. And where this gets especially confusing is with Medicare supplement plans because they use the A, B, C, D. So it's important for me or whoever you're working with for you to make sure that they know whether you're asking them about a plan or whether you're asking them about Medicare. So on a quick overview, Medicare Part A and B are known as Original Medicare. And Part A covers hospital, skilled rehab, if you have a 3-day hospital stay, some skilled home care. There's some of that also included in Medicare Part B, and then it includes hospice care. The important thing to know is that Medicare Part A never covers doctor's costs, even if you are in the hospital. That always is a Part B charge. So Part B charges include doctor's visits, specialists, outpatient care such as labs, x-rays, emergency rooms, ambulances, any outpatient procedures, medical supplies such as durable medical equipment like oxygen, diabetic supplies, hospital beds, wheelchairs, and then preventive services, which includes things like vaccines, and annual screenings such as like a mammogram or colon screenings, colonoscopies, those kinds of things. We're going to skip over to Part D for a moment, which is prescription drugs, and D only covers prescription drugs. Those prescription drugs are basically covered as an outpatient, meaning, again, that's covered when you are either in your own home, in an assisted living, or in a nursing home. Prescription drugs in the hospital are covered separately, so as part of their fee, and prescription drugs for hospice is covered separately. Medicare Part C basically is Medicare Advantage, and that includes A and B and D all in one plan. And then they often add additional services such as dental services, transportation, vision, hearing, etc. But they cover the basic Medicare services. So let's look specifically at Medicare Part A. So in 2023, the deductible per benefit period, which is 60 days, will go up to $1,600. And each time you go to the hospital, If you go between after 60 days, you will be subject to that $1,600. Now, most people do not pay that $1,600. Most of the time, that is either paid by a Medicare supplement, or if you have a Medicare Advantage plan, you will have a different type of copay. Medicare Part A is free to most people if you have 40 quarters of Social Security. If you have less than that, you do have to pay an annual premium, and you can let us know and we can help you figure that out. If you are in the hospital, days 1 through 60 after the deductible of $1,600 is free. Days 61 through 90, excuse me, are $400 a day. And if you are unfortunate enough to have to stay in the hospital more than 90 days, then you start to use your lifetime reserve days, and those are $80 a day. Similarly, if you go to a skilled nursing facility for rehab, days 1 through 20 are free, and then it is $200 for days 21 through 100. After day 100, Medicare no longer pays, and that presumes that you still need skilled care. As an inpatient, to cover any services in either skilled rehab or home care, you have to be in for what we call 3 midnights as an inpatient, and you have to be admitted as an inpatient. Now, you can be in the hospital in emergency, but there you are in as an outpatient. Now, if they plan to admit you in an inpatient status, but don't have a room, and they tell you that you are admitted as an inpatient and still in the emergency room, then that will count as one of the 3 midnights. The way that we suggest that you do this is that you confirm your status every day that you're in the hospital to make sure you know whether you're in as an inpatient or as an outpatient. Similarly, the hospital has to give you 2 types of notices so that you know what your status is. So the first one is the MOON, or Medicare Outpatient Observation Notice. And this is a notice that says that if they are going to keep you in the emergency room for more than 24 hours, then they have to let you know that. Most of the time in recent years, since this particular requirement has been in force, we have not seen a lot of people stay in emergency for more than 24 hours. Either they discharge you or they admit you as an inpatient. The other document that you will see when you are in the hospital is what we call a hospital discharge notice, or an important notice, an IM from Medicare. That is a document that has to be signed by you or your power of attorney prior to your leaving the hospital. Medicare Part A then has these 5 benefits. As I mentioned a few minutes ago, hospital inpatient care can also include mental health inpatient coverage. And we are now not totally, but much closer to having parity for mental health services, as well as for chronic disease or acute care services in hospitals. The skilled rehab stay, as I said a few minutes ago, days 1 through 20 are $0. Days 21 through 100 are $200 per day. And after day 101, you pay 100% out of pocket. And there are 2 requirements. You must meet the 3-day inpatient hospital stay, and you must continue to need skilled services for either nursing and or therapy. If one of those requirements is not there, then you're not eligible for the skilled rehab stay. For home care under Part A, there is no copayment, there is no charge to you. Again, you have to meet the 3-day hospital stay. You have to need the skilled nursing or therapy requirement. And if you do have to be homebound. Homebound basically means that Medicare has a very strange definition, but it basically says that you have to be needing it has to be taxing and very difficult for you to leave your home. You can leave your home under 3 conditions and still be classified as homebound. 1 is to go to church, 2 is to go to an adult day program, and 3 is to go to the doctor's office. The 4th benefit in Medicare Part A is the hospice benefit. For the actual hospice services, there are no charges. As I said a few minutes ago, hospice charges prescriptions differently. And if you are in hospice, you pay $5 per prescription. They have an additional benefit called respite care. And you can qualify for usually somewhere between 5 and 10 days of respite care. This allows either someone to go to a, say, skilled facility for a few days while you just rest up, while you go out of town, while you go on vacation, or you can also have respite in your home and they can provide care in the home. Under hospice care, you always have to pay 100% of room and board. To qualify for hospice, you have to have a terminal diagnosis of 6 months or less. The way that works is that they will initially authorize it for 60 days, and then another 60 days, and then another 90 days. So if after 210 days you have been on hospice and your condition is continuing to decline, it can be extended beyond that. My sister, who's a hospice nurse, says it doesn't happen very often, but from time to time, she does find herself having to extend stays beyond the 210-day period. Some people are also discharged from hospice because their condition stabilizes, and then there's a situation is not declining, so then hospice does have to discharge. Let us move now to Part B, or medical insurance, which is outpatient and preventive services. So this is the decrease that you will see in Medicare for 2023. Not a big difference, but the monthly premium that they deduct from your Social Security check will decrease to $164.90 from $174, I'm sorry. And the annual deductible, which this year was $233, will decrease to $226. Unlike Medicare Part A, where you have to pay the deductible every 60 days when you go to the hospital, under the Part B deductible, that is only paid once a year for the first amount of services that you use. Now, it is also possible that if you are in a Medicare Advantage plan, you would not pay the Part B deductible, but rather you would pay different types of copays. So the Medicare Part B standard premium, the $164, most Medicare beneficiaries will pay that $164. But approximately 5% of people around the country, because they have a higher income, will actually pay more for their Medicare, both Part B premium as well as their Part D and drug premium. This is basically goes into effect for individuals who, as an individual, make around $97,000 a year, as a couple around $185,000 or $190,000 on your adjusted gross income. The out-of-pocket expenses, then, the way that Medicare Part B works, if you're in original Medicare, is that Medicare pays 20% of this approved, or 80% of the approved charge, and you pay 20%. In addition to that, if your provider, your doctor, or whoever accepts what we call assignment, then what they're going to receive for your visit is the 80% that Medicare pays, plus the 20% that you pay, either through a Medicare supplement or for some people who are very low income, that may be paid by Medicaid. If you are in a Medicare Advantage plan, basically your outpatient physician services and some other services usually are paid on a copay, but things like the durable medical equipment, some of the outpatient services, frequently you pay that 20% out of your pocket. In addition to the 20% that you pay for Medicare Part B, if your doctor does not accept assignment, then your provider can charge an additional 15%. So let's use an example. If you go to the doctor and he charges $100, Medicare says, thank you, doc, that's only worth $40. So Medicare is going to pay 80% of the $40 or $32. You pay 20% or $8. If the doctor does not accept assignment, then he can charge you that 15% or an additional $6. If he accepts assignment, all that you would pay is the $8. There is no annual limit on the Part B expenses. So whatever the amount of charges that you incur, then you always incur the 20% and maybe the 15% depending on who the provider is. Most people, if you have a Medicare supplement, pays both the 20 and the 15%. If you have Medicaid, it pays that. This is just a quick diagram that shows you what is covered and not covered by Medicare Part B. So, as I said, doctor's visits, outpatient care such as MRIs, CAT scans, labs, x-rays, home health care. Home health is covered under both A and B. Durable medical equipment like wheelchairs and preventive care. Part B does not cover hospitals, that's an A. Skilled nursing, that's an A. Dental, vision, and hearing is a C. Hospice care is an A, and prescription drugs are a D charge. Now, a new thing that is happening in 2023, which we are all very excited about, is that the Inflation Reduction Act says that there will no longer be any copays on vaccines, regardless of where you get them. So some vaccines you will always want to get at a pharmacy. Others you could get at the doctor's office, a community clinic, or a pharmacy. Part D vaccines you want to get at the pharmacy because they are an approved agency or pharmacy to bill Medicare Part D. Most doctors' offices and community clinics are not approved to bill Medicare Part B, or they're approved to bill B, but not D. So you want to get those at the pharmacy. So flu, pneumonia, and hepatitis, you can choose wherever you want to get them, and they will be able to bill. Under Part D, shingles, Tdap, and COVID, you always want to get at the pharmacy. Starting in January, the copay for a shingle shot, which has kept many people from getting the shingle shot, will be covered at 100%. On a federal call the other day, they told us to wait until about February to actually present to get a shingle shot. And I'm guessing that's because they're working on getting all of the paperwork on the back end and they don't want you to get denied. So let's look at this Medicare supplement, which I told you can cover some of the A and B charges. And the supplements are the A, B, C, D programs. So you do have to pay a monthly premium for a Medicare supplement. The amount that you pay depends on the company that you have purchased it from, the plan, as well as your age. Starting January 1, 2020, if you purchased a Medicare supplement, the most comprehensive one you could purchase was a Plan G. Some people, though, will have a Plan C or an F, which is also very comprehensive, but those are plans that are no longer being sold in the marketplace. If you have a Plan F, it will pay the Part B deductible. This is just a graphic that shows how a Medicare supplement works. You go to the doctor or a provider, they bill Medicare. Medicare then pays their approved amount, not the billed amount, but the approved amount. And then they send that on to your Medicare supplement or your Medigap. Your Medigap then pays whatever is left over on the 20%, as well as the excess charge if the provider charges it. The benefits of purchasing a Medicare supplement is that basically it covers what we call the coverage gap. So the plans are standardized. A plan, regardless of who you purchase it from, a Plan A is an A is an A. A C is a C is a C, a G is a G, a G. So I always tell people that you shop these based on brand loyalty and price. If you have a Medicare supplement, you already have all of these benefits. If you are looking to purchase one, here are some of the reasons why you may want to. So a Medicare supplement, you can choose any doctor in the United States as long as they accept original Medicare. You don't have to have a referral to see specialists. They are guaranteed renewable, meaning as long as you pay the premium, they cannot drop you. So if you use $1 million worth of care in 2023, in 2024, they still have to keep you as an insured. You do have predictable costs, meaning that you have whatever the charge is for the premium, and then they're always going to pay that 20% and the 15%. So it's predictable. You know what your premium is, you know what your Part B premium is, and you know that the deductible this year will be $226. A Medicare Advantage differs a little bit from a Medicare supplement. These are readily available in the marketplace at this point in time. So open enrollment is right now. If you are currently in a Medicare Advantage plan and you want to stay, then you don't have to do anything. If you are looking to change Medicare Advantage plans, you need to make that change before December 7th, and then coverage starts January 1, 2023. Most Medicare Advantage plans cover Part A, Part B, and they have Part D, or the prescription drug, embedded. So this is just a graphic that reiterates what we just talked about. So you've got the Medicare Advantage covering all of the Part A, B, and D benefits. Now, your out-of-pocket costs for Medicare Advantage plans are variable. So most of the plans in the marketplace in Colorado in the next year have a zero premium program. This is very attractive to a lot of people because if you are buying a Medicare supplement, you may have, if you're under 65, about $150 monthly premium. If you're 75 or 80 or 85, your monthly premium might be $300 or $400. The Medicare, and that is per month, the Medicare Advantage, highest premium this year is $186 a month. You can have these premiums deducted from your Social Security checks. You can send them a check every month, or you can do an auto pay out of your bank account. The annual amount, if you remember, I said under Medicare Part B, if you're in original Medicare, you're out of pocket, there was no cap on it. You're out of pocket, and that matters if you don't have a Medicare supplement, that covers it. If you have a Medicare supplement that covers your out-of-pocket, then you're not as worried about it. If you are in a Medicare Advantage, the out-of-pocket, the lowest one that I found was $2,900 a year. The highest is $11,500. These amounts are negotiated every year with Medicare. So just because you have a plan, say with Kaiser, that is charging $5,000 out of pocket this year, doesn't mean that they will charge $5,000 in 2024. So that amount is negotiated every year. The deductibles, usually those also vary. They're usually on hospital charges, and those can be $200, $300, $400 per day for days 1, 2, 3, and 4. And then after that, similar to original Medicare, the Medicare Advantage usually pays full. The drug deductible in a Medicare Advantage also varies. It can be 0, or a lot of the companies this year are using the standard Part D plan and are charging the $505. The copays and coinsurance, as I said, usually some of the charges are a flat fee, some are 20%. And then on the prescription drugs, it depends where and what tier the drugs are on. And those can go as high as 50% of the cost of the drug on that tier, if it's a tier 5 or a specialty drug. And as I said earlier, if you go to skilled rehab, days 21 through 100 are $200 per day. So in Colorado, we have 5 different types of Medicare Advantage plans. We have the standard HMO, which probably most of you are familiar with. In an HMO, basically you go to whatever doctors and providers are in the network. If you go outside of the network, then there's an additional charge for being outside of the network. We have PPOs, or preferred provider organizations. Some of you may have been familiar with this type of form of healthcare in your employment, where if you stay in the network, you pay the network's negotiated charges. If you go outside of the network, and you do have the flexibility to do that, you pay the higher copays, but it gives you the flexibility to do that. The private fee-for-service, which is my least knowledge, or my least favorite of these, is basically there is a network, and if you stay in the network, then you get the network prices. However, what I do not like about this particular plan is that your provider does not have to serve you every single time, or they don't have to accept the payment from the insurance company every single time, or the Medicare Advantage plan. So I don't see this as a very stable type of health insurance. And I try, if you want a Medicare Advantage, to steer you to either a PPO or to an HMO. We also have special needs plans. There are 3 types of those. There are D-SNPs. These are primarily usually focused on low-income individuals who have both Medicare and Medicaid. I think every company that is selling this year in the Denver area has one of those. We also have a few C-SNPs. These are special needs plans that focus on a particular chronic disease. The majority of them in Colorado this year are looking at substance abuse and alcohol abuse, although they can also be for chronic obstructive lung disease, they could be for dialysis, so they could be for any number of diseases. The last one is an I-SNP, which is called an institutional SNP. This is if you want a special needs plan and you are in either an assisted living or a nursing home. Not every company sells in every nursing home, nor do they sell in every assisted living, but some companies are selling in those places. And then the last one is an HMO point of service. This is a special program where, say you are in a Medicare Advantage plan and you are traveling outside of the service area, and say you're one of the snowbirds, you live in Colorado, you have Kaiser and you go to Arizona for the winter. If you buy a point of service contract, then you are still in network with Kaiser when you get care in Arizona. Whereas if you were in their straight HMO program, you needed care when you were in Arizona, that was not emergency care, then you would be out of network. These are the 10 companies that are selling Medicare Advantage plans in Colorado. Now, not every plan sells in every zip code and county in the state of Colorado. So all of these, except Rocky Mountain Health Plans, is available in the Metro Denver area. Humana and United or AARP United are the two that are primarily available on the western slope and down in the valley as well. Now, if you are in the Metro Denver area and you had Bright Healthcare, Bright Healthcare is leaving Colorado. You should have received communication letting you know that, and that if you had Bright, you do have to enroll in a different health insurance plan. You have two choices. You can either enroll in a Medicare supplement with a guaranteed issue, meaning they cannot underwrite you, or you can choose another Medicare Advantage plan and they will automatically have to take you. You do have to make this decision by December the 7th. One of the things that Bright had on their website was they encouraged everybody to fill all of your prescriptions by December 31st to avoid any problems. And then as of January 1, update your pharmacy with either your Medicare supplement and your standalone prescription drug information or your new Medicare Advantage plan. If you are unfortunate and you have to go to the hospital and you're in the hospital on New Year's Eve, Bright will cover through New Year's Eve, and then your new company will start covering January 1. The next part of Medicare is prescription drugs, or Part D. And again, we are in open enrollment right now, October 15th through December 7th. Coverage will start January 1 of 2023. Prescription drug coverage is offered through prescription drug plans or private plans. And you can either pay the premium out of your bank account, you can send them a check, or you can have it deducted from your Social Security check. So this is a graphic that shows you what the standard deduction is for Part D for 2023. Not every company follows the standard deduction. Not every Medicare Advantage plan follows the standard plan. So again, when you are shopping, you will want to look around. So the standard plan starting January 1, 2023 is that you pay the $505 deductible, meaning the first $505 of prescriptions that you purchase in 2023 are subject to that deductible. The initial coverage and the coverage gap are the donut hole. If you spend more than the $505 on prescription drugs and less than $7,400 on your cost, as well as what the company pays, then you go into catastrophic. And under the initial coverage and the coverage gap, you pay 25% of the cost. And then when you get to catastrophic, If the amount you pay and the amount the company pays is more than $7,400, then you pay $415 for a generic and $10.35 for name brands. Now, one of the things that the companies did in 2022 is that some prescriptions were not subject to the $505 deductible. So they were outside of that. In some ways, that's a good thing, because basically then you're not having to meet that deductible and all you pay is the $500 or the copay. On the downside of it is it takes you longer to get into the initial coverage and the donut hole if you have expensive drugs and you end up in catastrophic. A really exciting thing for 2023 is that the Inflation Reduction Act that was signed by the president a couple of months ago changes insulin. So starting January 1, 2023, you will pay $35 per month per vial or insulin pen per type of insulin. Now, not all plans are participating, and it's not subject to this Part D deductible that we just talked about. So if you have a short-acting and a long-acting insulin, you will pay $35 per month for the short-acting and then $35 for the long-acting, and that will be for the first vial that you buy each month, and then after that, there should be no copay. Now, if you are using the plan finder at Medicare.gov to decide which prescription drugs plan you are going to enroll in for 2023, do not put your insulin in because they have not been updated to reflect the cost for the insulin. So run the plan finder with your prescription drugs without that, and then add the 35 or 70 or whatever it is that you need, because you know that that's what your out-of-pocket will be for insulin each month. The out-of-pocket costs for the standalone Part D plans are kind of like the Medicare Advantage plans. I can give you some general parameters, but I cannot give you any specifics because all of these vary by plan. So in 2023, the premium, the lowest premium is $3.20 per month. That is a WellCare plan. And the highest is $129 a month, again, depending on the plan. Most of the plans, when I looked at them, are charging the $500 deductible. A few of them are charging less, but as I said, a lot of the drugs on the generics that people take regularly may not be subject to that deductible. On the co-pays and the co-insurance, those, again, vary by company. The maximum out-of-pocket for the drugs, including what the plan pays, plus what you pay, is $7,400. And then we just talked about the diabetic, the insulin exception. Now, it's important to know that if you are a diabetic and you are not getting your syringes and your lancets and those kinds of things, if you're paying out of pocket for those, if you go to a Medicare Part B provider, Medicare will pay the 80% and you can pay the 20%. And the most frequent one that I know about in order of being able to purchase those is Walgreens, because Walgreens has both a Part B provider number as well as a Part D provider. Walmart, King Soopers, Kroger, and Safeway do not have a Part B provider number, so they're going to charge you full price. I did hear, but I have not confirmed it, that Kroger was looking into becoming a Part B provider. So you can ask, just make sure that you ask Part B for boy and not Part D for drugs. These are the 9 companies that are selling prescription drug plans in Colorado in 2023. Unlike the Medicare Advantage, these Part D plans have to sell in every zip code and every county in the state of Colorado. So my suggestion is that you shop them based on your current drugs, your current your current price points, and then change if you need to. Doesn't matter if you have pre-existing conditions, doesn't matter what drugs that you're currently taking, they have to take you every year. A lot of the companies have switched the prescriptions that they have on their formularies within the different tiers. So it is probably worth your while to check those out. The other thing that I want to mention at this point in time, which gets very confusing, is Aetna, Anthem, Cigna, Humana, and AARP, United Healthcare, all sell Medicare supplements. They sell Medicare Advantage plans with a prescription drug embedded, and they sell standalone prescription drug plans. So make sure if you are either buying for the first time, switching Medicare supplements for some reason, or switching to a Medicare Advantage plan, or reviewing your prescription drug plan, that you understand that those companies sell multiple products. The average charge for Medicare Part D for 2023 in Colorado will be $41.62. So your decision points basically are you need to consider is the cost of, whether you can, the healthcare that you need, as well as the insurance plans. You need to consider whether or not your doctor is taking whatever insurance it is that you are looking for, what type of healthcare that you need in times of an emergency, especially if you are out of the state, what kind of care you can get, where you go to get services, a clinic or a doctor, and then what your prescriptions are. So all of those things need to be taken into account when you are making a decision. So this is just a quick overview of Part A, B, C, and D, and what we have talked about up to this point. I will point out that I changed this on the PowerPoint on my laptop and forgot to change this one on the PowerPoint here on my desktop. The monthly premium for Part B, that is the one that is decreasing, and it will go down to $164. So you have a choice to make. If you are new to Medicare, you need to decide whether you're going to go path 1 or path 2. If you are changing from a Medicare supplement to a Medicare Advantage, or are considering it, whether you want to go path 1 or path 2. Going path 1 means you have a Medicare supplement with a standalone plan. People who have Medicare supplements or who are looking to change, unless you are in your initial enrollment period, can change at any point in time. That does not have to be done by December 7th. However, any changes to your prescription drug plan or any changes to your Medicare Advantage plan do need to be done by December 7th. This is basically a quick graphic that shows that if you are having difficulty paying your Part B or your Part D premiums, there is help available Part B is paid for, or if you meet the income and resource requirements, through the County Department of Human Services. And the Part D premiums you can get support for them by applying through the Social Security Administration. They can help with premiums as well as copays. Couple of things related to new enhancements that Medicare has put into place for the future. So we've already talked about the 2023 changes, primary ones being the insulin and the vaccines. In addition to that, if the prescription drug companies charge too much for the prescription drugs, they have to pay a rebate to Medicare. The big one that we have been hearing a lot about in the election is in 2025. We said that the cap this upcoming year on out-of-pocket expenses was going to be the combination of what you pay and what the company pays, $7,400. 2025, what you pay, that will change, and what you pay will be $2,000. The other thing we've been hearing a lot about with the election is that Medicare, the government or Medicare will be able to negotiate with the drug companies. In 2026, there will be 10 drugs that Medicare will negotiate with the pharmaceutical companies. And in 2027, that will go to 15 drugs. And by 2029, there will be some additional ones, but it's not a lot of drugs. Other things that Medicare has done the past year is that they've redone their homepage. They do now have on their website prices for Medigap policies. There is some improvement on the plan finder, so it's a little bit easier to use, not quite as confusing. And this chat line, actually, I used it a couple weeks ago, and it worked relatively well. So what are some of the services that we can help you with here at the Gerontological Society? So we can help you with some Medicare counseling for parts A, B, C, and D on enrollment, counseling for Medicare supplements or Medicare Advantage, or prescription drugs, and we can do that in either English or in Spanish. We also can help you with some support services. So if you are needing a referral, say to an insurance agent, we can help you with that. We have a limited number of appointments left for clinical reviews by the University of Colorado School of Pharmacy. So if you are looking to get some information about the prescriptions that you're currently taking, maybe you feel like they're not working together properly, or you just want to know what some other options are, contact Pat Cook from our office, and she can probably get you linked up with the students at the pharmacy, at the School of Pharmacy. You can also get information about all of the sessions that we have taped this year, as well as last year, at our YouTube channel. And some of them have been updated, and some are, the information is adequate from years prior. And you can also visit our website. A couple of things just to make you aware of in terms of things that the Society does. And so this is just a list of some of the direct services that we help with, or that we can facilitate. We don't actually provide them, but we provide counseling. We can do referrals. We do some granting of services. So we do have monies for our vision, hearing, and dental services. You can either be or request help from the telephone buddies. And we are going to be doing holiday baskets, but only in the Metro Denver area. Our dental services are available on the Western Slope. Anything west of I-25, except El Paso and Pueblo County, is eligible. Our vision and hearing, unfortunately, are only available in the Metro Denver area. This is a little bit about the education and advocacy services that we provide. If any of you are looking for our senior resource guidebook, those were delivered in the fall, or I mean in late summer, to all of the libraries around the state. And that concludes our presentation for today.